Good afternoon, everybody. We're just going to, hopefully you're here for the Health Innovation Networks and the ABHI webinar. We're going to wait a minute or so just to get everybody joining. So I know sometimes it takes a little while to get teams going, but thank you very much for joining us this afternoon. We're going to give it a little bit longer and then we'll get going in about 45 seconds or so. Okay, thank you. And I guess for any of our presenters who've got their mics on, if you could turn them off if you're not talking, thanks. And that goes for everybody. So then we'll get going in a bit. Great, thank you. So hi everyone. I know you're kind of getting people into the lobby now. We're here for the Health Innovation Networks and ABHI webinar, which will kick off about now. So great, thanks very much for joining. There'll probably be more people joining as we go. Welcome everyone, thank you and good afternoon. This is the Health Innovation Networks and the ABHI webinar, really looking at working together to support innovation and impact in health services. Thank you so much for joining us. I'm going to run through some housekeeping and kind of the agenda as we go. So housekeeping, session is being recorded. We may publish it, we may not, we may take excerpts of it just to be aware. And we will make a PDF pack of all the slides. We'll send that out after, probably next week, if that's okay. So you don't have to take copious notes. You can trust that we'll send you kind of all the references. You can see them afterwards. General kind of pointers, if you could use the chat function to ask questions as we go. The chat's easier than the Q&A. So please use the chat. We'll keep an eye on them and we'll pick them up at the end of the session to answer any big kind of themes out of that or anything else that comes up later on. You shouldn't have your cameras and mics on. I think we've controlled it so you can't do that unless you're a speaker. But if you can, just keep it muted just in case if that comes up. And during the question and answer, we can unmute if you really want to speak. Otherwise, just use the chat function. Okay. So thanks very much. The agenda today, hopefully very straightforward and what you're expecting. I'm going to do this little welcome and introduction part. So I'm Matthew Lawrence. I'm Head of Industry and Innovation at Health Innovation Oxford and Thames Valley. So I'll be kind of just setting up the webinar with everyone. We're going to hear about ABHI's work from Richard Phillips very shortly. And I'll talk a little bit about Health Innovation Oxford and Thames Valley, what we do, where we work, and then a little bit about the NHS and the system where we work, specifically around the Thames Valley area. We're then going to hear from Paul from Accel-Heal Technologies about kind of their experience of what they're doing with their technology, their innovations. And then we're going to do a little bit of a panel question and answer period for about 15 minutes, 10, 15 minutes at the end, just to set your expectations. Okay. So the objectives, for those who like objectives, kind of learning objectives, is from this, you should understand kind of more about how your work as an innovator could be enhanced through working with the Oxford HIN and the ABHI. You can learn about some of the available support and the NHS system, so how it gets received and what happens with that, and understand how to become a member of ABHI. I'm sure Richard and Paul can tell you all the benefits of that as well. And then you can learn from innovative companies, so Accel-Heal, and how they've worked with both Health Innovation Oxford and Thames Valley and the Health Innovation Networks in general and the ABHI. And then also find out how to contact and engage with Oxford HIN as well. It's pretty obvious, but we'll go through that. We'll put the kind of contact details in the chat functions if you want to get in touch with us. Okay, so hopefully that's kind of what you've come here to expect. So you're in the right place if that's what you're looking for. So I'm going to send it over to Richard now, and I'm going to run his slides for him. So I'm just going to stop sharing for a moment. I'm going to bring up his slides right now. Give me 2 seconds. Okay. Okay, hopefully you can all see that now. I'm going to leave it over to Richard now. So Richard, over to you, talking about kind of ABHI. Thanks very much.
Matthew, thanks very much, and good afternoon, everybody. And as it happens, Matthew, I'm sat doing this from Unipart House, which will mean something to the locals on the call. But otherwise, Unipart House is in Cowley, near the heart of the old motor industry here. And part of the building I'm in is used by Oxford University Hospitals and NHS Trust. And we've been running a seminar here this morning with some of our members and the chief finance officers from OUH, and also Royal Berkshire Hospitals Trust. We've been talking procurement, value, and how you capture some of that good stuff. So it's as it happens, we happen to be on the patch there, which is great. And it's also just giving you an example of some of the work we do as an organisation. So if we have the next slide, please, Matthew. And I'm not going to spend long. I'm going to try and do this in 5 minutes because this is not really about us. It's about our friends in Oxford and Thames Valley and the Health Innovation Network there. There's one of a series of events we've done, webinars, Friday webinars, and and my colleague John is online as well. He'll type in any additional information we need. But I think I'm right in saying, John, we're on course to get through all 15 HINs by the end of the year, and so it's really the opportunity for them to talk about their work, say a little bit about their local systems. I'm just going to give a few slides just for, I'm conscious there are some people on the line who probably don't even know there are such things as industry associations. Tell you a little bit about what our work, what we do, and some of the things that are bothering us at the moment. So we are the industry association. We represent the HealthTech industry. We define HealthTech as medical devices, diagnostics, and digital health technologies. And we do everything you would expect an industry association to do. Perhaps our most important role is we work with policymakers to try and shape policies such that it is it's favourable for our industry, and everything we kind of do is based around that. And we have high level interactions with government, and our members get the opportunity to shape and engage in those conversations. A big part of what we do is regulation. I'll say a little bit more about that. We have deep relationships within the NHS. Some of this is what I've already talked about this morning. Some of it is this very event we're doing now with our friends in the Health Innovation Networks. But we have close working relationships with a number of organisations and regions across the UK, including, for example, the Shelford Group of Hospitals, where we have a rolling programme of meetings with them. They offer up networking opportunities as well for our members. Our insight, intelligence, and resources is the best you'll get in the sector. It's done by the industry for the industry. And if you joined and all you did was read our outputs, and briefings, you'd be better informed than anyone else because it's made by industry for industry. And also we do a lot of work to try and help companies support export overseas. I'll say a little bit more about that. We're about 20 people all in. Most of our leadership team look like me. They've been around for quite a while now, having come from industry. And we have about 400 members, and we're broadly representative of the industry. So we have a long tail of SMEs. Conscious there are about 4,500 other companies out there in the space, depending on whose data you believe. But we think our members account for about 80% of the volume of the industry. If you do the next slide then, please, Matthew. This is how we're organised, and this is quite an important slide. So we're organised both by functions and business area. So those big business areas for us are regulation, market access, policy and partnership, and communications. But within that, we also focus down on digital health. We have a director for digital health, a director who looks after medical devices, director for diagnostics, and a managing director for international. That's important because it gives us scale, and that enhances our credibility as an actor with the institutions, the government, and other stakeholders. But it also allows us to be specific. So we're not niche, but we can be specific. And in the middle of it, just a very, very small selection of some of our stakeholders. And you see the Health Innovation Network is called there. But we interact with the various institutions of government probably on a daily basis. Next slide, please, Matthew. We'll just give you a flavour of our work at the moment. We've got three priorities. So growth, that is growth of the industry, growth of companies within the industry, and growth of individuals within those companies, as well as helping the healthcare systems we serve grow. Regulation is huge at the moment. We're a highly regulated industry, as you know, and we're going through an enormous amount of reform at the moment. That's how we organise our regulatory arrangements for medical devices and diagnostics in the UK. That is exercising most of our waking hours for the past 2 years. And increasingly, there's a big element of ESG and requirements being put on suppliers who want to supply the NHS that. So there are three priority areas. Within that, we've got a number of work areas, which have obviously lots going on within them. I won't go through them all, but just to call a few out. Health inequalities is obviously a big deal for the NHS. We're thinking a lot about how what is our role of industry, not identifying inequalities, but what can we do as industry to help address some of the inequities in the delivery of healthcare that we're all aware of. ED&I work, that is part of what we do as an organisation, but also help some of our smaller members on their journey with EDI, and similarly for sustainability. Huge requirements. If you want to supply the NHS, continue to supply the NHS, there's an NHS green agenda and certain criteria you have to adhere to. And we published a couple of years ago now a roadmap for mainly SMEs to tell people about what you need to do by when and who the kind of people that can help you. Next slide then, please, Richard, which is nearly the last one. I'm not going to go through this and all. This is a slide I always say that all the people from Guinness for the world record for the most number of words on one slide. When you get the slides, this tells you a little bit of how we're organised, who you need to go. It's our kind of wheel. So if you will find in there topic areas and who's responsible for each, it helps us navigate our way around our own organisation. The last slide, which is just to point out where you can see red are some of the areas where over the year we will have overseas activity, be it trade shows like Arab Health, like Africa Health, or whether it is our missions we run to other markets, notably the US. If you are a company starting out on your export journey and you are at all serious about exporting to the US, then the most cost-effective thing you could do would be to join our US Accelerator, which runs 5 or 6 missions a year to various US states, where you'll have the opportunity to meet C-suite senior decision leaders in up to 20 different hospital systems. I think that's a real whistle-stop tour, Matthew, because I don't want to use any more time. I want to hand the time back to you guys, but not necessarily a presentation that lends itself to a lot of questions, but happy to join in the panel. Anything else, please do pop stuff in the chat, and John can make sure you've got all the information you need. But I'll leave it there, Matthew, if that's okay.
Great, thanks very much, Richard. Hopefully that's a really good overview for everybody about what ABHI does and how they can help you as a business as well. Obviously, get back in touch with ABHI and Richard if you want to have a bit more information around that. So thank you. We're perfectly on schedule, which is great. So the next bit I'm going to do is talk a little bit about Health Innovation Oxford and Thames Valley, kind of who we are. If you don't know that already, you may do. So I'm not going to go read every word of every slide, but I'll kind of give you an idea of what we do, kind of how we do it, then talk a little bit about the kind of the NHS system around us. Again, you might know some of this. It's really just background information, and if you don't know it, it's a good kind of reminder of kind of how it's all set up now. So just gonna, there we go. So okay, so here we are. So again, we're Health Innovation Oxford and Thames Valley. So you might remember our name is Oxford AHSN, Academic Health Science Network. Every academic health science network changed its name back in October last year. So we have new names, but we're doing exactly the same role. So we represent the Thames Valley area. And for those of you who don't know, we're part of a national network. So you've heard the term Health Innovation Network. That's the term that kind of talks about the collective of all 15 health innovation networks across the country. That is the country, England is what we represent. So every part of England has a health innovation network, and every hospital or NHS provider is a member of a health innovation network. And we work closely with academics and other people around that to kind of really bring innovation to the NHS and to healthcare. And we're really licensed in 2023 for another 5 years till 2028. So we're here to kind of keep working with innovators, work with researchers, people with great ideas, and the NHS to help kind of find those solutions. So as a health innovation network, including our own one, we're kind of health innovation adoption experts. We're really here to get things out to people and get them effectively done. We've got So more than 3.2 million patients have benefited from some of our national programs since 2018. We've had around more than 340,000 hours of healthcare staff capacity released through those programs since 2020. And that's more than 2.6 billion pounds of investment leveraged by the companies we've supported since 2018. And 10,000 jobs created or safeguarded in companies we've supported. And about a 3-to-1 return on investment delivered through our innovation support. And that's using kind of Treasury Green Book methodology. So against any of those measures, the impact of what the Health Innovation Networks is doing is really powerful. It is returning a lot of great kind of returns and developing economic growth for the UK and also internationally for those companies who then go into other markets outside the UK. So really Health Innovation Networks, so including us, it's about local change, but with national impact. So we're tackling national problems with a local understanding, and then we're using local problems, we're doing that with national expertise. And so each Health Innovation Network, so us included and everyone else, we're fully embedded on our local health and research ecosystem. We're working with them on a daily basis, finding out what their priorities are and helping them to support that. And we're driving economic prosperity and growth in all those parts of it. And you see that little kind of Venn diagram on the right. It's really showing kind of where we intersect. So we've got the life science industry, which is represented by ABHI and other kind of industry bodies, health and care, which is pretty much the NHS, but also local authorities, others delivering health and care across the UK and internationally, and then academia doing that research. We kind of sit at that kind of convergence of all those three areas, helping all of them, facilitating and making sure that stuff happens really effectively. And we've been doing that for over 10 years now. So we've been working with all those groups. We're commissioned by NHS England and the Office for Life Sciences to do that work. A lot of that work is free to innovators up front. We signpost, we guide, we help develop that work as well. We accelerate the adoption and spread of those innovations, particularly those which are really, really promising. And through that, we improve those outcomes, experience, and patient safety, which is what we're all trying to achieve, and trying to address health inequalities. So where they exist, identifying them and finding ways to reduce those. And really, as we're all aware these days, trying to save the NHS money and delivering more for less and delivering economic growth behind all that. For us locally in Health Innovation Oxford and Thames Valley, we serve a population of about 3 million people in the counties of Buckinghamshire, Berkshire, Oxfordshire, and then the health systems of Frimley and Milton Keynes. We match those high value innovations with identified population needs, and we empower NHS staff to do that. Often we see that capacity is a challenge. There aren't enough of the right people to do the right things sometimes, so trying to find ways to innovate to do that more effectively, whether those be with new devices, digital tools, or kind of new ways of doing things, new pathways, new kind of projects to do that. For us specifically, we focus on 4 clinical priority areas, which are cardiovascular disease, maternity, neonatal, mental health, and respiratory disease. That's not the only things we do, but we focus those on specifically. We also do other work as well. You'll find that all 15 health innovation networks will have a different clinical specialty area, probably closely matched to what's needed in their area. Those are kind of national ones as well, but those are the ones that we particularly focus on. And our current offer to industry. So what we can do to help you, we can kind of help facilitate partnerships around kind of that, but really kind of finding identification of need, doing horizon scanning, innovation management, doing real world evaluations. So actually in practice, does this work? Does this help kind of achieve those ends? Pathway redesign, adoption and spread, which we've referenced before, and then really development and training, getting staff and workforce people understanding how to use things. We've got a range of other services, including health economics, patient and public involvement, net zero, so as Richard mentioned, sustainability and the net zero agenda for the NHS is really strong now, and we've got environmental economics is there as well, workforce engagement, health inequalities work, digital transformation, and grant and bid support. So if you're looking for money or you're looking to develop your innovation and get the evidence behind it, really your Health Innovation Network is there to help support you to do that, to walk you through how to do it, how to access funds, and to find the right partners to actually get that evidence in place. As a couple examples, the first one's an adoption and spread example, which we led from Oxford and Thames Valley, which was around kind of preeclampsia testing with Roche Diagnostics. They had a test called PLGF, which is placental growth factor testing, really to identify those patients who would be at risk of preeclampsia. Did lots of work, worked around the NICE guidance on that, developed an implementation pack, and really looked at saving the NHS money, but also helping improve the experience for patients. So expectant mothers, them, so exactly what they're doing through their pregnancy and doing that work, and then leading on that with all 15 health innovation networks. So it's virtually in every kind of delivery suite in the maternity ward now, they are using this testing out there. So it's one of those great success stories. It's taken a few years, but it's now one of the leading things, and the UK is one of the leaders in terms of that. So just really great work working with Roche Diagnostics, an ABHI member, but also work with all of those bodies and those entities to make that happen safely, and also to save money, but also improving patient outcomes and patient safety. Another thing that we do quite regularly working with our health systems is horizon scanning. So a fancy word of looking what is out there to solve that. A good example was a recent report we published, which is around scoping digital support for children and young people's mental health. This is particularly around 2022, just at the end of kind of COVID and lockdown. Big fear that the mental health problems were being exacerbated by a lack of access or people's inability to get out. So we did a huge amount of work around that, looking at kind of what digital tools are out there to help support that, to give clinicians confidence that patients weren't getting worse or they were being treated remotely where possible. And that's really kind of stuff around all that. You can see that getting deeper understanding, shortlisting innovations, reviewing the evidence and adoption readiness and kind of the innovation technologies. And for that one specifically, there's a link here which we'll send out later, the innovations against kind of the Thrive framework to make sure that they worked for all mental health networks and could be adopted across the country or elsewhere as well. And those are kind of a snapshot in time kind of scans that tell us what's available now. We know things have developed and changed, so we like to refresh those and look at other things as well as they come out. And as I mentioned, we're funded predominantly by NHS England and the Office of Life Sciences for the kind of free work we do for innovators. We also do work directly with companies who maybe don't want to go through those things, but we can also support going for grants through a lot of the grant giving bodies, SBRI, Innovate UK, things like that, through UK Research and Investment, working with the National Institutes of Health Research and others to try and make sure those things get done. So that's kind of a whistle-stop explanation of kind of what we do as Health Innovation Oxford and Thames Valley. The next section I'm going to go through is a little bit about how the NHS, is laid out. You might know this already, in which case you'll probably just get a refresher. So it's all about the kind of the national NHS kind of thing, so how things get funded, and then secondly, really about how it is in our local system. So the two integrated care systems, which I'll talk through as well. Okay. So, underpinning principles of the NHS, most people know this already. I've taken this from the very, very useful HFMA guide, which is an introductory guide to NHS finance. It's almost 300 pages, but explains kind of everything you ever wanted to know, and maybe a bit more about how the NHS is funded and how things work in that sense. But the principles of that, which I think most people know, is that it's available to everyone. If you're a UK resident, you have access to the NHS. It's free at the point of need for patients. So when they need it, they don't have to pay. So if you've ever been to other countries, the first thing they often take is your insurance or your payment details. That doesn't happen in the NHS in the main. It's based on clinical need, not the ability to pay. Those are the core principles behind the NHS, which we kind of know when we live in the UK, but when you go internationally, those aren't universal principles everywhere else around the world. But that's kind of how the NHS is kind of structured. Something to check out if you haven't seen it before. It's been out for a while now. This was launched by Simon Stevens when he was chief executive of the NHS, is the NHS long-term plan. And it's really setting out how the NHS, and NHS England particularly, wants to drive change through local systems to achieve better health in the UK. So that's preventative healthcare, keeping people healthy, screening, finding all sorts of things to make sure that happens, and making sure there's an NHS to be able to deliver that. So it's not enough just to identify the problem, but they're also laying out solutions that they want implemented. And the structure of the NHS has changed a few times in the last few years. The most recent restructure happened in 2022. You might be aware of that. Thing to be aware of here really is that there's still Department of Health and Social Care at the top. NHS England looking after all of England's health and social care. So it's very different in Wales, Scotland, and Northern Ireland. They're slightly different systems, but they're funded by Department of Health and Social Care. And then this bit here I'm going to talk about a bit more is the 42 integrated care systems right here, which across England, there are 42 of them. They've got integrated care boards, integrated care partnerships. So the board is a legal entity which buys and commissions services for the local healthcare system. And the partnerships are the group of all the providers who provide those care things as well. Bits that haven't changed so much, local authorities still exist. They haven't changed in that much. They've taken on responsibility for public health. So if you're trying to create an innovation that works for public health, there'll probably be a local authority who might be buying that. And that's preventative things like, smoking cessation and things like that. Primary care networks are groups of GPs. You can see all the other different kind of entities down here who haven't changed so much in the last few years. So that's kind of the Health and Social Care Act things to be aware of. So the most change is kind of right there between NHS England and then the bodies between them and the providers. And the least change are the ones at the bottom. So here's a map. You probably won't be able to see all the detail on that. So July 1st, 2022, these systems took over from clinical commissioning groups, CCGs, which themselves took over from PCTs, which are primary care trusts. Again, you probably don't need to know the detail of that, but you'll see that you're working across different parts of England. Some of them are much larger geographies, probably representing a less populated area, and London obviously got a whole bunch because it's very populated. And you'll see we work kind of in the middle here with Buckinghamshire, Oxfordshire, and Berkshire West ICS and Frimley ICS. And so if you want to understand kind of how these integrated care systems are set up, they use terms which you need to kind of be aware of depending where you're going to pitch your innovation. Things called neighborhoods, which are kind of groups of GP practices, so primary care networks, about 30 to 50,000 people. Places, these are kind of larger areas like 250,000 to 500,000 people. That's just kind of a larger grouping there. And then systems, the whole thing will be a system. The integrated care system, the S is a system. This is an example from NHS England talking about how that's set up, obviously around Sheffield and kind of Yorkshire, but that's kind of a model that you can think. So if you hear place, neighborhood, system, those are the terms that explain how the NHS is thinking about those areas. So under that, you've got national priorities, as you'd expect. So NHS England set out in 24-25 kind of key priorities and operation planning guidance. You won't be able to read all the detail there on the right. There's a link at the bottom there you can follow. But the four kind of key things they're looking at, really, amongst others, are improving access to primary care. And primary care means general practice, so what you think of your GP surgery, but also dentistry and other primary care services. That can also include pharmacies. So getting people access to that. So being able to get to an appointment with a doctor or a nurse when you need it, or having the screening and everything else following up. The next one, reducing waiting lists. We know that waiting lists have kind of gone up with COVID for different procedures, lots of electives and things like that. They're trying to reduce that. So systematically reducing those. And the next bit, you'll see a lot of this, if you're particularly with digital innovation, you'll know more about this probably. It's moving care out of hospital. That includes remote monitoring, virtual wards, some other terms that have been out there. So trying to get more things done outside of an acute hospital setting, maybe in a GP practice, in a community hub, some other kind of location as well. These are the key themes behind it. And the last one is getting people back to work. So those people who might be unable to work through some health condition, for whatever else, trying to get them back to work through the NHS, through all that support that the NHS can offer. That's really the plan there. Those are key priorities. So that's kind of the national priorities, and expect all those 42 integrated care systems to reflect those priorities as well. So they do. So I'm going to show the two main ICSs that we work with, which is BOB, which is Buckinghamshire, Oxfordshire and Berkshire West ICS. So they've got four key outcomes they're looking for really in priorities. One, generally, they want to improve outcomes for their population health and healthcare. Really good aim that everyone would expect. They want to tackle inequalities in outcomes, experience and access across the whole area. They want to enhance productivity and value for money, and they want to support broader social and economic development in the area. And they've got a budget of about £2.5 billion a year. That's a lot of money. Most of it is already kind of, budgeted for and allocated. And the way they're delivering that through the main things, through acute and kind of large trusts, is through two things called provider collaboratives. Again, another term you might want to be aware of. But if you're trying to sell to a specific hospital, it might be useful to know if they're part of a larger collaborative. Where if you get into one, you can get into the other ones as well. So for BOB, ICB and ICS, they've got three: an acute provider collaborative, Royal Berkshire NHS Foundation Trust in Reading and around there, Oxford University Hospitals NHS Foundation Trust, which has 4 hospitals in Oxfordshire, and Buckinghamshire Healthcare NHS Trust, which covers most of Buckinghamshire. And there are 2 mental health provider collaboratives, Oxford Health NHS Foundation Trust, who provides mental health services in Oxfordshire and Buckinghamshire, and Berkshire Healthcare NHS Foundation Trust, who provides mental health services in Berkshire. So that's kind of to understand how they work. The next one we work with is Frimley ICB, Integrated Care Board, an Integrated Care System. And they've got a focus, they've mainly said, on 5 major health conditions. Again, there's a lot more detail in their own documentation, but these are ones you probably expect. So focusing on cancer, stroke services and neurology, cardiovascular disease, diabetes, and respiratory. And what you'll see from most of these, like the national things, is these are long-term conditions, which can be quite, not treated well and managed. People can get worse, or they might not be as productive as they might want to be. So their population is about 820,000 people, and they call it 5 places. So Bob's got 3 places: Buckinghamshire, Oxfordshire, Berkshire West. Frimley's got 5 places that they call for their areas as well. You can see kind of the configuration here of who the providers are, what they're doing. There's lots of local authorities they're working with as well. So you can see how it's all kind of including all the different partners in that grouping. So hopefully that explains a little bit. Now, this slide is just a very generic slide, just to explain, depending what your innovation is or what you're trying to do, you should probably understand who you're going to pitch it to. So we talked about primary care here. That's what, GPs and community hubs and eye care, dentistry, things like that. Secondary care, most people know, associate with hospitals. In community health, that's services that out in the community, and tertiary care is specialized services, specialist things that probably are done in very few centers of excellence who lead on that stuff. But depending where you're trying to pitch it to and what your device or your innovation is, you need to understand kind of where you're going. Department of Health and Social Care, obviously the very top. NHS England, maybe something just beneath that if you want a national program. NHS Digital looks at all digital things. They'll give out standards around how to do that. And then the integrated care systems, which we just talked about, they're the ones who might be doing it on a system-wide basis. Very hard sometimes to get in this as a budget or something, a program area they're looking at. And where most people are working with is care providers. So directly to hospitals, directly to local authorities who are putting out a tender, or they have a need to fulfill, and they will purchase your product and do that through their own procurement mechanisms, just to be aware of that. Okay. Again, I'm going to reference this guide. I'm an NHS manager by background. I work in finance departments, so I love this document. But one I think everyone should look at if you want to kind of understand exactly how the payment mechanisms work. So how NHS trusts get paid, how GPs get paid, how the money flows from the Treasury all the way down to whoever's providing that care in the NHS. It's really useful. It is quite long, so you don't want to dip in and dip out of different sections. And they do update it regularly when changes come through. There's a link to it there. And essentially, if any of that is a bit overwhelming or a bit confusing, which it can be, especially if you've not dealt with it before, do get in touch with us. So our contact details are there, info@healthinnovationoxford.org. We've got a website. It talks about all the things that we do, and we don't just work on our own. We do work with the other health innovation networks. We work with the ABHI and other industry bodies as well. And we work with lots of innovators already in the system, so we can help you kind of join up with them and figure out how best they do that. And that's really kind of the plan behind it, is really just to be a facilitator, to help project manage, to kind of enable things to happen across the NHS and across the system, no matter where you are. And if nothing else, we can always signpost you or give you some more information to help you come on that journey. Okay, great. Thanks, Peter. So I'm going to hand over to Paul now, if that's okay. Paul, you're going to run your own slides, so I'll stop sharing and let you go. There you go. So Paul is going to talk a bit about Accel-Heal, and once he's up and ready to go. That's great. We can see that, Paul. Thanks. I think your mic's on mute, though, unfortunately, Paul. So if we unmute you.
Okay.
Great.
That should help. Yeah, just 1 second. I can't see my own slides at the moment. I'm not sure. Let me have a look.
If you run them as full screen, then they'll be easier to read as well.
Yeah. 1 moment. Oh, that's better.
That's great. Thanks.
Thanks, Matthew. Yeah, sorry about that, everybody. I think it's the challenge of trying to run multiple screens. Sometimes you can lose your slides. But yeah, good afternoon. And Matthew, thanks very much for the invite to join you today. My name's Paul McKenna. I'm a commercial director for a company called Accel-Heal Technologies, which is a very small medical device company. And what I'd like to talk to you about is the launch of a new innovative device, Accel-Heal, which is really tackling a silent epidemic, which is that of chronic wounds. So within my presentation, what I'd like to do first is just tell you a little bit more about this silent epidemic and how big it is. the innovation that we're trying to bring to market. And then last but not least, how we've worked with the ABHI and the Oxford Health Innovation Network to find a pathway to success for our product. So a little bit about the company to begin with. I just wanted to get across here that we are a very small SME. Started up in 2019 to commercialise a new technology using electrical stimulation to kickstart wound healing in very chronic wounds. In terms of the experience in the team, though, we do have a lot of experience. I've come with about 30 years experience in the medtech environment, most of which has been within a large corporate, Smith & Nephew. So within that organisation, I was able to run regional and global teams focused on the commercialisation of new technology products, which was fantastic. But then I've hit the challenge now of working in a smaller company, which perhaps doesn't have the scale and definitely doesn't have the scale and resources of a larger corporate. And you are very much reliant on bodies such as the ABHI, Oxford Health Innovation Network, to give you appropriate guidance and get you on the right path to succeed. So small company, just 6 of us in the business, and most of our sales are within the UK, parts of Europe, especially France and the Middle East. And it was interesting earlier that Arab Health was mentioned, which we have found very useful and a good opportunity for that region to actually find good partners and distributors to help commercialize our products. We've not looked at the US opportunity yet, but if our business grows further, that would be something we look at. So it was very interesting to learn about guidance within the US market earlier in the earlier presentation. So first one I'd like to get across is just the cost of wound care to the NHS, and it's actually around £8.3 billion per year. So that might seem a very large number to some of you, and I just wanted to put that into context. The cost of diabetes to the NHS is around 10 billion and lung cancer 2.4 billion. So there's a huge amount of money being spent on the management of wounds, which isn't always visible because that expenditure is across different segments of the NHS, whether it's hospital or community. The other striking fact is that a lot of people, usually elderly or those with diabetes, who have chronic wounds actually have them for a very long time. So patients with leg ulcers, diabetic foot ulcers, often have them for longer than 12 months. And during this period of time, their life can really be quite miserable. They can be in pain and have a very poor general quality of life. Can affect their mobility, their ability to work, and does have a significant impact on actually their mental well-being as well. In terms of looking at the costs further, if you think of that 8 billion being spent on wounds, most of the cost is actually on these wounds which do not heal. So the ones that are around actually over 12 months, 63% of that cost is focused on the management of those wounds. And this is really where, as a company, based on my prior experience, is where innovation is required, focused on those wounds which have been around a long time, can actually get forgotten within the system, but are actually costing the NHS a lot of money and causing those patients continued misery. In terms of technologies out there, there's been a lot of research done across universities and in different parts of the NHS using a technology called electrical stimulation, which it actually passes an impulse across the wound to actually kickstart that wound into healing. And historically, this has been used in very large devices and has been quite difficult to use and only used in hospitals. The innovation of what has been developed by Accel-Heal is actually to make that technology available in a portable form. So something the size of a key fob, which comes pre-programmed and can actually be set in motion with a simple click of a button. So it was developed with a view to actually bring that proven product with so much clinical evidence across all all care settings within the NHS and indeed other markets. So designed to be able to use, but with a clinical credibility of a product that has a lot of clinical trials behind it. So in terms of working with the ABHI, what we feel it is very good at is representing the needs of the industry at the very highest levels of the NHS. So within this, and it's the way I've tried to convey it is in four sort of key stages. One is the insight, and that is really about what problem we're trying to solve. So some of that data I shared earlier, the ABHI is in a perfect position to raise that within the government, within the NHS, about the issue of hard-to-heal wounds, which may not always be on their roadmap as one of the priorities for care. So getting those wounds to heal, managing their pain, understanding that strong analgesics can be actually used in these wounds and they don't always have to be, and getting across really a different approach is needed, and that there is data out there to support that other approaches work. Next part of working with the ABHI is obviously their role in identifying key work streams and providing companies with a seat at the table, providing a more welcoming environment to work with the NHS, and also with regulators. As a small company, we've been very reliant on the guidance that they've provided around ISO certification and other regulatory activities, and also the documentation and projects that they've started which may affect our business in the future. So they do have a collaborative project at the moment looking at changes in reimbursement in the drug tariff, and as a small company it would be very difficult, almost impossible, to keep up with some of these changes if there wasn't a body such as the ABHI pulling them together, sharing what is happening and representing the needs of industry. So it's been good to actually, really from a personal basis, it's allowed me to keep up and when we need to be involved and when we don't need to be involved. Also providing a seat at the table has been really an opportunity to show how innovation could help, and really thinking about by customer type who we should speak to, making sure our documentation resonates really on an emotional and a rational basis, and really by understanding how specific we need to be, working with bodies such as NICE on gaining guidelines for specific wound types, for instance. That all works very well. And then we come to really the launch of an innovation with the NHS. The NHS organisation is very innovation driven, but in my own personal experience, and I think this is across wound management generally, the change can actually be quite slow. I think sometimes within this area, some of the physicians involved are looking at comparing it to other disease states where there can be different levels of evidence and different quality of data shown when you have a more homogeneous patient group. So working with the ABHI, it's good to make sure our evidence is focused as it's at the required level. But the challenge that we've then got is actually how to drive adoption and get approval within the different ICBs and different elements of the NHS. And that's really where working with the Oxford Health Innovation Network has put us, I think, on the right path to get a change in the standard of care for stalled wounds. So I think everybody we meet within the NHS, all wound care professionals, all wound experts, are very emotional about this. They want to make a change, but it isn't always as straightforward as you might imagine. So if I could talk about our history so far, we have some very good clinical data, healthcare economic data, and then we've worked with different tissue viability groups around the UK who've then done a small evaluation just to confirm that they get the same results that we're showing in our clinical trials, and also show some cost effectiveness. But after that, we've tended to, and they've been incredibly supportive and want to push through the use of this new technology. We've been very excited, but then we've tended to hit, and a lot of accounts, somewhat of a brick wall within the NHS. Meds management has become involved. I've challenged a couple of things, and then the kind of whole project can begin to fold. And at the same time, patients continue to suffer, and the costs involved in using a technology like this are very low. So for us, it's been quite frustrating. So what we've tried to do is really go back and have a fresh approach, and we're doing that particularly with the Oxford Health Innovation Network. And I'll just talk about how we got started and how we're planning to proceed. So in terms of getting started, I think for us, it was to find a clinician who was empowered and wanting to make a difference. And certainly our local agent worked with a lady called Julie Hewish. So she was a tissue viability nurse originally, who then actually moved within across to the Health Innovation Network. And she could actually see the challenge that we were facing and wanted to transform the wound care, but wanted to do it in a system in a way that would actually get final approval. I understand locally that they'd had challenges previously with some other technologies. So it was a case of actually going back to understand what we need to do at the very beginning of the project before making that first step. And I know Julie had a lot of experience of building business cases. Then our local agent also met with yourself, Matthew, to really understand the way forward and actually how to move forward within the innovation network to gain that final approval. And I think these initial meetings were crucial because it would be so easy for a company such as ourselves to jump a few steps, have some evaluations done, but then not actually end up with an output that is actually approved at the end. So in terms of moving forward, one of the first steps was really to illustrate the unmet need, not just look at the national data, which I've shared, but to look at the benchmarking of the current rate of stalled wounds locally within the region, understanding the impact that was having on patients and also the costs involved. Illustrate by building some clinical evidence that unmet need is addressable, something actually can be done. So this is involved and just in the process of it at the moment, an evaluation by the tissue viability team and understanding how this would fit into their existing pathways, rather than just create a new pathway, understand the current pathway and how actually Accel-Heal may help improve outcomes for those patients. Cost is obviously very important to the NHS, and decisions around making the right choices are always forefront of mind. And I think this is an area where new technologies can fall down sometimes if they're not actually showing the cost in actually the right setting and actually the improvement in cost savings that can actually be made. So as part of the formulary submission aligned with the low limb pathway, we, through Julie, have set up meeting actually with a healthcare economic team within the NHS. And that has been very valuable to provide design and the relevant data we need to capture to show a robust economic case, what would be accepted, what wouldn't, but also other aspects that meds management will look at, such as sustainability, impact on the quality of life of patients. So there's a number of areas there that it was great to get that guidance on to make sure that we capture that in our final submission. And some of these areas we may have missed. The sustainability, for instance, we may have not featured so highly, even though our product is a very sustainable option. And then finally is actually the launch of the product, making sure we support and deploy some in-servicing to help with the local training. And then last but not least, what we'd like to do is build on the success of Oxford and take to other ICBs around the country and actually say this is how we've done it in Oxford as an example, and then actually build from there. But making sure we do it correctly and follow all appropriate steps in the first place to actually get that final success. So that's really summarises where we are at the moment, and yeah, we're really excited to be working with the team there, and we'll continue to do so.
Great. Thanks very much, Paul. That's really, really helpful to understand kind of how you've approached it, how the ABHI has helped. And I'm glad to hear that we've helped as well to do that. I know Julie's, it was a national wound care program that she was working on, but also doing local stuff on that.
Yeah.
So really great to see. And I think we can all recognize that it's a large area, one for patients, but also the NHS, maybe under-recognized. So something where innovation really can make a big change. So innovations that really make a difference for those patients. If you think about the experience of having a wound that isn't healing, to live with that, but also the management around that is really complicated, and also just the bandaging and everything else that goes on. So thank you very much. I think now we've got some time for question and answers. I can see some questions are in the chat already, so I'll pick some of them up. I can see that Peter Ellingworth has joined. I don't know if he wants to speak. If you do, let us know, Peter, and we can make your mic and your camera available. So Peter is the Chief Executive of ABHI. But let me just go through some of the questions here. So I think there's a question here about how you know what each of the Health Innovation Network's clinical specialties are. Every Health Innovation Network will cover kind of everything in the national scheme, but they will specialize in certain ones. They'll publish that on their website. Another source of information and kind of support you can go to is the NHS Innovation Service that was launched about 1.5 years ago, maybe 2 years now, and it's at innovation.nhs.uk. There you can fill in a long form, which goes through all your details, and on that you fill in the detail, and then you will be a needs assessment service will look at what you've got, and they will allocate you to the respective agencies that can best help you. So whether it's a local health innovation network or a health innovation network that specializes in the area you're working in, or it might be to NICE, or it might be to other groups as well. So that's a good place to start if you don't know. If you don't know, speak to your local health innovation network, and we can signpost you, introduce you to another health innovation network as well. Peter, you have joined us. That's great. Do you want to say a couple of words? I'll let you introduce yourself, but great to see you. Thanks.
Thanks, Matthew. So hi, everyone. Peter Ellingworth. I have the privilege of running ABHI, and I also now have the privilege of not just being on the board of the Oxford and Thames Valley HIN, but also as of September, I'm the new chair. So very much looking forward to getting involved. And Matthew, what a terrific evocation just now of both what the HIN can deliver and what the environment is that it works in and the system it works with. And Paul, fantastic story. I've got a background. I used to be working for one of your competitors, Convatec, back in the day. So I know the space. And I think this journey that you've described there, Paul, and the HIN, along with colleagues in our organisation, ABHI, have played a small role in enabling for you, is really where the benefit is for health innovation networks, because we all know that the fundamental challenge is there is no top-down adoption and diffusion that's ever really been effective within the NHS. And for the HIN to play its role in supporting the healthcare system across that geographic footprint, it's got to be able to bring technology into patient pathways and have that. I think the other thing, Paul, that I think you need to be congratulated on there is the benefit that, and Matthew touched on it, that patients will feel. Chronic wounds are a real problem in our health system because they're dispersed right across it. You can't walk into a wound care ward in a hospital. It doesn't work like that. It's not like many, many other pathways that are very clearly defined. Wounds are everywhere, and the consequences of stalled wounds is significant if you think about care homes alone. So Matthew, delighted to be able to join. Really look forward to working with the team at HIN. And Paul, thanks again. Absolutely terrific story. Much appreciated.
Thanks very much, Peter. I'm glad you could join us. It was touch and go whether you'd make it in time, but that's great. Great to see you and great to hear the lovely compliments there. And hopefully, Paul, obviously you got great support from ABHI. Hopefully we can support you as well. But the other health innovation networks as well. Like I kind of mentioned before, the 15 health innovation networks by design are collaborative. So if something works here, we can work with other parts of the health innovation network across the country and with our partners in Scotland, Wales, and Northern Ireland to make things available. It is not as easy as people might think. You do have to work locally, know the right place to go to, whether it's community district nursing teams, whether it's in the acute sector, in kind of, in hospital sites or elsewhere, to find out how to do that. And it's a bit of trial and error, but it's just being persistent and getting the right support and evidence behind it. So thank you very much. So I'm just thinking now's kind of an opportunity for questions. If you've got questions for me or for Paul, for Richard, for Peter, if you've got any questions, put them in the chat. I'm just going through here. I think there was a comment here. I think Jonathan's already answered that one around the meeting you mentioned, Richard, where there's some kind of outputs to members from that meeting you had in Oxford. Maybe they are, maybe they're private, but hopefully there's something that other people can learn from as well. And if you want to touch on that one quickly, Richard, if that's okay.
Yeah, it's part of a series of engagements we have, and our members will see. We'll be able to get a readout of it. But again, it's the opportunities, it's the network and the deep relationships we have. And we were looking. The discussion today was really about how we create, realise, and actually measure value jointly. So there's some guidance come out from NHS England about valuing how you savings and value methodology. So how do you account for savings that might not obviously be cash releasing, maybe their bed days? How do you put a cost on that? And interesting discussions about it hasn't really been disseminated deeply throughout the service, but these are the type of projects I think. And Paul mentioned the sort of higher level work we do, but these are actually, they are quite high level, and we can do work together with organisations like yourselves, Matthew, and other bodies. Today in the discussion, the Healthcare Finance Managers Association and the Healthcare Suppliers Association were mentioned, referenced as being vehicles potentially do that. So those type of collaborations generally, and then have a practical output as well. So and then, as I mentioned, they're part of a network of events, like indeed this one, which our members get access to. And then they inform our work. So it was interesting discussion, but one of many we have.
Great, thank you. I think kind of my observation from about 16 years in the NHS is that if you have a really keen clinician who really likes your product, your innovation, it's very unlikely that they alone can take it forward and have it purchased by their system, by their trust. They have to work with the managers, with the finance team, the procurement team, to make sure it's purchased legally and within the rules of the NHS. Like any public sector body, they have to get value for money, make sure it's got all the accreditations. Paul referenced that you have to have the right regulatory kind of accreditations for what you're trying to do. The ABHI can help you with some of that. We can help as well to a certain degree, but you have to have the right thing. It's a risk-averse system, but one that's also looking to really affect a big change and do it with a big value for money as well. So you have to kind of take all those things into account. And I take on board your point, Paul, that if you're a small company, it's hard to have all those functions inside. So I referenced a case study from Roche Diagnostics. Obviously, they're quite large internationally, so they will have resources, do their own health economics and things like that. But small SMEs, sometimes you need a bit more help and support, which we're here to do. And ABHI and other groups as well can help you and help you kind of represent it, so you have a bigger voice and a bigger representation in terms of all those systems looking at stuff. Any other questions, really? Now's your chance to kind of raise them. Might be, maybe we've talked you through. Paul, I mean, is there anything else you want to say kind of as a wrap up, kind of any points you've kind of learned or you kind of want to share with other potential innovators or companies who might be in a similar position to you about what next they should do? That'd be really helpful, Paul. You're on mute, I think, Paul.
Yeah, is that okay? That's good. Yeah, I think just in one sentence is don't jump a step. So I think we, as a smaller company, absolutely enthusiastic about our technology, and we're perhaps moving too fast in some aspects of the NHS. We get small evaluation, great results, and then we're expected to move forward. Well, things just don't happen like that anymore. Probably 10 years ago they did, but not anymore. And I think it's working closely with health innovation networks, ABHI, actually having that structured approach, making sure you're very clear what the end result is, needs to be shown to meds management to get that final approval. So it's not just actually what your kind of tissue viability nurses, your physicians are saying, it's actually ticking all of the boxes at the end of the road to make sure you get that approval. And for me, that's the most useful aspect. It's easier to do in a larger company or a bigger corporate, where you do have a lot of different functions such as market access, healthcare economics manager, and a lot of these can be looked at. Where in a small SME, you need to actually receive some guidance and some help to actually achieve that end goal.
Great, thanks, Paul. Hopefully all these kind of insights and kind of from people with experience has really been helpful to you as a company. If you want to take forward any of these things, really, please do get in touch with ABHI directly. If you understand about membership, they can explain all the benefits. Richard's talked about some of them. Peter has as well. I think you can see there's a huge strength there, particularly for getting UK. The UK represented on a global stage, particularly, as well as in the UK. If you want to know more about Accel-Heal, obviously, Paul, I'm sure you'd welcome kind of some contact there.
Yeah, absolutely.
Especially for tissue viability nurse or a system looking to implement some technology, please get in touch, come through to us. Obviously, for Health Innovation Oxford and Thames Valley, get back in touch with us as well if you haven't already. It's info@healthinnovationoxford.org. Go to our website, learn more about that. Really do get in touch. We're here to help. That's our job. We love doing it. We love to see really great things taken forward and advanced. So thank you very much, everybody. We're just on time. I'll close the meeting now and say thank you very much. Okay. Bye.
Thanks, mate.